Does massage improve blood circulation? Is blood circulation important? What does it do? In this video, we're going to be talking about massage and its effect on blood circulation coming up. Hey guys, Aaron here with NPC Alternative TV, giving you the safest and fastest tips to alternative medicine using manual therapy. And today we're going to be talking about a very interesting topic. But before we start, go ahead and hit that like button. Go ahead and subscribe. The more you like my videos, the more the more videos I get to make, and the more videos I get to make, the more fun we have learning. But today's topic is on blood circulation. How does massage affect blood circulation? How does blood actually circulate our whole entire body? It does that through the heart, because we know that the heart acts as a what? It acts as a form of a pump. It pumps blood. It delivers blood. The moment it contracts, it pushes all that blood to every single system in our body, right? It sends it to every single system. It sends it to the organs. It sends it to the muscles. It sends it to the glands. It sends it to every single cell, trillions and trillions of cells in our body, right? But what does blood carry? We know that blood carries oxygen. Let me write that down. Blood carries oxygen, right? It carries hormones, right? Minerals and vitamins. So we can say that when the heart contracts, it pushes out blood that's rich in nutrients, right? To be able to deliver to the cell, because it's through the cell that we sustain life, the basic unit of life. But where does that start? We know that it starts off in the area of the lungs, because the moment we take a deep breath, we're inhaling what? We're inhaling oxygen, and we exhale carbon dioxide. We exhale carbon dioxide. Now, the moment we inhale oxygen, it sends that blood, it goes down the trachea, which is the windpipe, and it sends it to the lungs, and it's through this blood vessel that it snatches, it steals, it robs that oxygen molecule, and then it sends it to the heart, and then the heart isn't going to act as what? It's going to pump, because that's what the heart does. It pumps, it contracts, it pushes that blood to a blood vessel, right? And that blood vessel, it's called a what? It's called an artery. Now, there's arteries, and if you want to get specific, the aorta, which is a very big artery, and then it sends it to the artery, and then it's so big. Remember that the cell is so small, we can't see it with the eye. We need machines, we need a microscope or something very specific that can actually see that cell in our body, because it's so small. So this is so thick, it can't be able to do that. It sends it to something or another blood vessels. It's called arterioles, right? Now you might say, it sounds very familiar. All arterioles mean is small artery. Remember, it goes from artery to arterioles, but even the arterioles are not that small to be able to deliver that type of, to deliver that blood, to deliver that oxygen, minerals, and vitamins to the cell. It needs something called, or it turns into something called capillary bed, right? Capillary beds. So remember, it goes from artery, arterioles, capillary beds, and then from capillary beds, it turns into something or another vessel called venules. And you might say, well, that sounds very familiar, because what arterioles is to arteries, venules is to vein. But remember, there's more veins, plural, sorry, but we're just going to keep it vein to keep it very simple. So it goes from oxygen, right? It delivers it to the arterioles, and it delivers it to the capillary beds, right? So it goes from oxygen, and it gives us back what? Carbon dioxide. So let's just say we eat a sandwich today. Today we eat a sandwich, we bite it down, we eat a pizza, our body breaks it down, we breathe in, we have all this sorts of, nutrient-dense blood already in our body, we breathe in, and in the blood, there's already what? There's nutrients to be able to feed that small cell, to feed every single cell in our body. But we can only take what we actually need. The rest is just waste, right? So we breathe in oxygen, and the waste for us is what? Carbon dioxide. Because the moment we eat that sandwich, or we drink a lot of water or a Coke, we only take what we actually need. And as a waste product, we just push it out of our system. We push it out through urine, we sweat it out, we breathe it out, or we go to the bathroom and we poop it out. So we give the cell oxygen, hormones, minerals, and vitamins, and the waste is going to be what? Carbon dioxide. CO2 to be specific. And then what else? Toxins. And now toxins can be a lot of things, but remember, we're keeping it basic. Toxins and waste product. Waste products. Okay? So remember, oxygen, hormones, minerals, vitamins, oxygen, toxin, waste products, out. So let's just put in, and then we'll just put out here. You get what I mean. Now, where does this happen? And I want you to pay attention to this. It actually happens in the capillary bed. Remember, because it's in the capillary bed, where actually that exchange happens. Not only of oxygen and carbon dioxide, but it's oxygen, hormones, minerals, vitamins, and it gives out toxins and waste products. It happens in the capillary bed because it's so small, the vessels, the walls of the vessels that make up that capillary bed. Because another concept that I want you to know, it's in the capillary bed. It's that actual combination of very small arterioles to very small venules. It's a combination of both, right? That's why the color starts to, when I was drawing this, the color looks kind of the same or starts to blend in, because it's that perfect combination in the capillary beds, because it's in the capillary beds where the area of tissue is, where the cells are waiting to be fed, right? So we take in the capillary bed, it takes in the oxygen, and that cell gives back what? Waste products. Now, a very important concept that I want you to learn, it does that to a concept called diffusion. Now, you might say, what's diffusion? Diffusion. That process of leaking in and leaking out only can happen to diffusion. Now, diffusion is what? And I'm going to explain that in this area. Remember, it's very basic, but if you can have an overall understanding of how does that happen. Diffusion, right? All that means is that gradients, such as molecules in this case being oxygen and carbon dioxide, going from an area of high concentration going to an area of low concentration to even out. That's the concept. That's the law that we use. And that's how this happens in every single cell in our body. Because if that doesn't happen, we can't carry out something very important that we need to sustain life. We can't carry out what? Cellular metabolism. Right? Because it's through cellular metabolism that actually life is being sustained in the basic unit of life, which is known as a cell. So, remember, oxygen is high concentration where? Inside the blood vessels, but not inside the cell. You might say, oh, but there's a carbon dioxide here. Yeah, but carbon dioxide and oxygen are not the same thing. It's in the cell, right? Let's take this out. Let's take out carbon dioxide. Oxygen, inside the cell, there's no oxygen. It's high here in the arteries. So it's going to go area of high concentration, and it's going to go inside the cell area of low concentration, and it's going to even each other out. That's how this happens. Now, how does carbon dioxide happen? Carbon dioxide, it's already high in carbon dioxide because remember, we take in oxygen, we give out what? Carbon dioxide. So high gradient of carbon dioxide, not oxygen, is high inside the cell. And then the low concentration is in the vein. So it's going to get area of high concentration to an area of low concentration, which is in the veins. And that is how the whole process of diffusion takes place. Now, let's go ahead and do a recap. So remember, the moment we inhale the oxygen goes to the lungs sends it to the heart sends it to the arteries sends it to the arterioles sends it to the capillary beds, and it's in the capillary beds where the fusion actually takes place within the area of the tissue, that is where the cells are located, where the cells are waiting to be fed. And then what goes in is, remember, oxygen, hormones, minerals, and vitamins. And then what do we get for exchange? We get carbon dioxide, toxins, and waste products. So then from there, the capillary bed sends it to the venule sends it to the vein sends it to the heart goes to the lung, and the moment we exhale, we breathe it out. So remember, that's how we go from oxygen to carbon dioxide. We inhale oxygen, we exhale carbon dioxide. This whole entire process happens every single time, the moment we inhale and exhale, in every single cell in our body. Now, that being said, you might be asking, okay, so how does massage have anything to do with blood circulation? Well, there's a certain condition called ischemia. All ischemia is the condition where the restriction of blood flow, the restriction of oxygen, vitamins, minerals cannot or unable to get inside the cell. Okay, because there's a restriction. And remember, if the cell doesn't get oxygen, if the cell doesn't get vitamins, if the cell doesn't get minerals, if the cell doesn't get hormones, the cell cannot survive. Cellular metabolism cannot occur. Okay? So how does massage have anything to do with this? How does ischemia happen in the first place? Well, it can happen through trauma. It can happen through stress, because remember, stress is a catabolic hormone. It breaks it down. It can happen through exercise. There's so many ways, so many conditions that can actually enable ischemia from happening, right? So what does massage do for this? Now, there's a very good book. It's called The Periodization of Training for Sports, written by Tudor Bompa and Carlo Busichelli. He's Italian. So what they say in the book is that at rest, when the body's at rest, the capillaries, right, are open only 4%. But with massage, a mechanical force, it can be open to 48%. Does that make sense? Now, you might be saying, okay, but ischemia, is it like something comes? No, it just happens. This happens in our body. You know, we can get it from, pain. It's a symptom that tells the brain, hey, something's wrong in this tissue, right? But with massage, like I said, if it's at rest 4%, but with massage, if we can prevent that from happening and open it up to about 48%, that's like getting a 48% raise. That's what we want. So this is another way, another alternative method of actually getting more blood to the tissue in order for you to carry out cellular metabolism. Not just cellular metabolism, there's way more that massage does, but that's just a tip of the iceberg of an alternative that we can use massage for blood circulation. Okay, so now you're asking yourself, okay, I love your explanation. I kind of understand it, or I need more information. Well, right now there's going to be two main articles that I'm going to pop that should be popping up right now in this very instant. Go ahead and take a look at that. If you want a better information about how massage affects blood circulation, or you're not convinced, go ahead and read that book, Periodization of Training for Sports, and go ahead and read those two articles. It should really help you. But again, my job is helping you through MPC Alternative TV, helping you find an easier way, a faster way to use alternative method through manual therapy. And I hope this video really helped you with that. So thank you so much, and thank you for listening.